grew up in a family that had cardiovascular disease, so I always had that in the back of my mind.
Family history is very, very key. Yeah, even in my clinical practice, I see a lot of young patients that come through and they see a cardiologist really just because of family history only.
As I continue to grow older, I pretty much try to stay healthy. I try to eat right and, go to the gym.
Or just, look at Miguel with his age. I mean, he would not be somebody that would strike you as, oh, he's going to be a high risk for having heart disease at all, especially knowing that, he exercises, eats well, even takes good care of his health.
Then one day I go to get my eyes checked, and an optometrist asked me if I had high cholesterol. And the reason he said that was because I had a white ring around my eyes, and he was concerned about cholesterol deposits. They put me on cholesterol medicine at that moment. After a good workout, I felt a little nauseated and didn't think much of it. I've been nauseated before.
So Miguel called me, and like you said, we had a pretty rigorous workout this morning, and so he went home and he first called me saying that he felt nauseated, and he was kind of concerned that it may be his heart. And I initially told him that, we know what a heart attack looks like. Surely you're not having a heart attack.
So I did go to Dr. Priest's office, and he opted to do a heart cath. Had the procedure done, and they found the blockage or the stenosis that was on that one vessel. Well, then they found a bigger blockage somewhere else in my heart.
Through the same IV, if you will, in the arm, my partner went in with his tools, the catheters and the wires, and essentially we were able to put a stent through two of his arteries to fix all the blockages. Yeah, I mean, typically a lot of the patients are diabetics, have high blood pressure, maybe they tobacco use, overweight, typically over 55 or 60 years of age, sleep apnea. So those are a lot of the risk factors that are, if you will, your bread and butter risk factors for heart disease. And besides him being diagnosed with high cholesterol at a young age and family history, really nothing else kind of stands out to say, well, you're at an increased risk for heart disease.
Just because you're skinny and just because you go to the gym and you think you're healthy, if you have a family history, genetics have no prejudice. It's something that you just need to know, and ignoring it will not make it go away.
Listen to your body. If you feel there's something not right in terms of your symptoms, whatever they may be, from nausea to dizziness or chest pain, certainly family history does trump a lot of your other risk factors, and so I would definitely recommend you seek evaluation, whether it be of your family doctor or go see a cardiologist.
Most of our major heart attack patients have said that they didn't listen to their symptoms. If they could have come earlier, they should have.